Earlier this year, I started getting emails about this book, The Plant Paradox, purporting to expose the hidden dangers in healthy foods that cause disease and weight gain, foods like beans and whole grains and tomatoes. Why? Because of lectins, which is a rehashing of the discredited blood-type diet from decades ago. They just keep coming back. Yeah, but this was written by an MD, which, if you've seen my medical school videos, you'll know is effectively an anti-credential when it comes to writing diet books, basically advertising to the world that you've received likely little or no formal training in nutrition. Dr. Atkins was, after all, a cardiologist. But look, you want to give the benefit of the doubt. The problem is that it doesn't even seem to pass the sniff test. I mean, if lectins are bad, then beans would be the worst, and so bean counters would presumably find that bean eaters cut their lives short, whereas the exact opposite may be true, with legumes, beans, split peas, chickpeas, and lentils found to be perhaps the most important dietary predictor of survival in older people in countries around the world. As Dan Buettner points out in his Blue Zones work, lectin-packed foods are the cornerstone of the diets of all the healthiest, longest-lived populations on the planet. Plant-based diets in general, and legumes in particular, are a common thread among longevity blue zones around the world, the most lectin-lush food there is. And if lectins are bad, then whole grain consumers should be riddled with disease, when in fact whole grain intake is associated with a reduced risk of coronary heart disease, the #1 killer of men and women, strokes too, and total cancer, and mortality from all causes put together, meaning people who eat whole grains tend to live longer and get fewer respiratory diseases, infectious diseases, diabetes, and all non-cardiovascular, non-cancer causes to boot. And not just in population studies. As I've shown, you can randomize people into whole grain interventions and prove cause and effect benefits. The same with tomatoes. You randomize women to a cup and a half of tomato juice or water every day, and all that nightshade tomato lectin reduces systemic inflammation, or has waist slimming effects, reducing cholesterol as well as inflammatory mediators. So when people told me about this book, I was like, let me guess, he sells a line of lectin-blocking supplements. And what do you know? Assist your body in the fight against lectins for only $79.95 a month. It's only like $1,000 a year, a bargain for pleasant bathroom visits. And then, of course, there's 10 other supplements, so for only $8,000 or $9,000 a year, you can lick those lectins. Oh, did I not mention his skincare line? Firm and Sculpt for an extra $120, all so much more affordable when you subscribe to his VIP club. But you still want to give him the benefit of the doubt. People ask me all the time to comment on some new blog or book or YouTube video, and I have to sadly be like, look, there are 100,000 peer-reviewed scientific papers on nutrition published in the medical literature every year, and we can barely keep up with those. But people kept emailing me about this book, so I was like, fine, I'll check out the first citation. Chapter 1, Citation 1, Forget everything you thought you knew was true. Diet books love saying that. For example, eating shellfish and egg yolks dramatically reduces total cholesterol. What? Egg yolks reduce cholesterol? What is this citation? This is the paper he cites, and here it is. By now, you know how these studies go. How do you show a food decreases cholesterol? You remove so much meat, cheese, and eggs that overall your saturated fat falls, in this case about 50%. If you cut saturated fat in half, of course cholesterol levels are going to drop. So they got to drop in cholesterol removing meat, cheese, and egg yolks. Yet that's the paper he uses to support his statement that egg yolks dramatically reduce cholesterol. I mean, it's unbelievable. That's the opposite of the truth. Add egg yolks to people's diets, and their cholesterol goes up. I mean, how dare he say this? And it's not like some harmless foolishness like saying the earth is flat or something. Heart disease is the #1 killer of men and women. This could actually hurt people. So much for my benefit of the doubt. In the 1800s, a compound was discovered in castor beans, which we would come to know as the first of a class of lectin proteins, natural compounds found throughout the food supply, but concentrated in beans, whole grains, and certain fruits and vegetables. Every decade or two in the popular literature and the medical literature, a question is raised whether dietary lectins are causing disease. It's easy to raise hysteria about lectins. After all, that first one found back in 1889 went by the name ricin, known to be a potent homicidal poison used by the Kremlin to assassinate anti-communist dissidents, or by rogue chemistry professors, for that matter. And ricin is a lectin. Thankfully, however, many lectins are non-toxic, such as those found in tomatoes, lentils, and other common foods. And even the ones that are toxic, like those found in kidney beans, are utterly destroyed by proper cooking. But you can't eat raw kidney beans. If you do, you'll be doubled over with nausea, vomiting, and diarrhea within hours, thanks to the lectins, which would otherwise be destroyed by adequate cooking. How do you even eat raw kidney beans, though? I mean, the only way they're sold uncooked is as dried beans. They're like little rocks. Well, in the first reported outbreak, an impromptu supper was made with a bag of beans dumped in a skillet and soaked in water overnight, but never cooked. You can't even just throw dried beans in a slow cooker. Dried kidney beans have to be boiled. Kidney beans should be soaked in water for at least 5 hours, and then boiled for at least 10 minutes. 10 minutes? 10 minutes? Kidney beans wouldn't be done in just 10 minutes. Exactly. Yeah, cooking pre-soaked beans for a couple minutes can destroy the lectins, but it takes like an hour of boiling before they're edible, before you can flatten them easily with a fork. So the lectins would be long gone before they're palatable. Without pre-soaking, it takes 45 minutes in a pressure cooker to get rid of all the lectins, but an hour to make kidney beans edible. So basically, it appears that cooking beans to the point where they might be considered edible is more than sufficient to destroy virtually all lectin activity. Even 12 hours at 65 Celsius won't do it, though, which is like the temperature of a cup of hot tea. But you can tell they weren't done, still firm and rubbery, though you can imagine someone putting those in like some raw vegetable salad, and look, that could make people sick. And it has, with dozens of incidents reported over the years, all of which could have been easily prevented had the beans been soaked overnight, drained, and then boiled for at least 10 minutes. Or if they would have just eaten canned beans. Canned beans are cooked beans. The canning process is a cooking process. None of the confirmed incidents were due to canned beans. We've known since the early 60s that conventional cooking methods can effectively destroy lectins in beans, and therefore it's possible to ignore any human problems that could be associated with lectins from properly processed legumes. So yeah, you can show that feeding lectins to rats isn't good for them, or to cell tissues in a petri dish, but in these articles that claim dietary lectins may be disease-causing toxicants, the only negative effect they can find on humans are those raw and undercooked kidney bean incidents. Do dietary lectins cause diseases of affluence? How about we test that hypothesis? So they performed a trial on 24 domestic pigs, and a paleo pig diet beat out cereal-based swine feed. Could they not find any people willing to eat paleo? In response to one such review of the evidence, based largely on laboratory rodents, one peer reviewer cautioned that we should not draw conclusions about the involvement of dietary lectins in the cause of diseases without definite and positive proof. That was written more than a quarter century ago, and no such clinical proof has yet to materialize. What we do have, however, is ever-growing evidence that legumes, beans, split peas, chickpeas, and lentils are good for us, associated with a longer lifespan, a significantly lower risk of colorectal cancer, a leading cancer killer, considered part of a natural, cost-effective, and free-from-side-effects solution for the prevention and treatment of type 2 diabetes. Randomize people to eat 5 cups of lentils, chickpeas, split peas, and navy beans a week, and you can see the same benefits in terms of weight loss and metabolic benefits that you do with caloric restriction portion control. And the whole lectins theory is based on lectin-containing foods being inflammatory. but prescribe 4 servings a week of legumes packed with lectins and get a significant drop in C-reactive protein. In fact, a 40% drop of this leading indicator of systemic inflammation, eating more beans. The purported plant paradox is that, on one hand, whole, healthy plant foods are the foundations of a good diet, yet we supposedly need to avoid beans and whole grains and certain fruits and vegetables because of the evil lectins. But if you look at the actual science, all whole plant foods are associated with decreased mortality, meaning the more of them people ate, the longer people tended to live. And this includes lectin-filled foods such as whole grains and beans. So maybe there's really no paradox after all. Lectins are to blame for the great white kidney bean incident of 2006 in Japan. One Saturday evening, a TV program introduced a new method to lose weight. The method was simple. Toast some dry, raw white kidney beans in a frying pan for 3 minutes, grind the beans to a powder, and then dust it on their rice. Within days, 1,000 people fell ill. Some with such severe diarrhea and vomiting they ended up in the hospital. Why? Lectin poisoning. 3 minutes of dry heat is not enough to destroy the toxic lectins in kidney beans. If you don't pre-soak them, you need to boil large kidney beans for a full hour to completely destroy all the lectins. Though if you first soak them overnight, 98% of the lectins are gone after boiling for just 15 minutes, and all gone by half an hour. And indeed, when they tested the white beans, toasting for 3 minutes didn't do a thing. No wonder people got sick. Whereas 95% of the lectins were inactivated after boiling them for 3 minutes, and completely inactivated after 10. Evidently, do not eat raw beans is a traditional admonition in Japan to avoid intestinal problems, and now we know why. While canning may completely eliminate lectins from most canned beans, some residual lectin activity may remain in canned kidney beans, though apparently not enough to result in toxicity. And ironically, low doses of lectins may be beneficial by stimulating gut function, limiting tumor growth, and ameliorating obesity. What? I thought lectins were toxic. For as long as people have speculated dietary lectins are harmful, others have conjectured that they may be protective. If this theory is correct, appropriate lectins by mouth should be of use in the prevention and possibly treatment of colon cancer. Or, of course, we could just eat our vegetables. Interest in the purported anti-tumor effect of plant lectins started with the discovery in 1963 that lectins could distinguish between cancer cells and normal cells. Researchers at Mass General found a substance in wheat germ, the lectin in whole wheat, which appeared to be tumor cell-specific, clumping together the tumor cells while the normal cells were left almost completely alone. So specific that you can take a stool sample from someone, and based on lectin binding to the colon lining cells that get sloughed off into the feces, you can effectively predict the presence of polyps and cancers. And subsequently, it was discovered that lectins couldn't just distinguish between the two, but extinguish the cancer cells, while largely leaving the normal cells alone. For example, that same white kidney bean lectin was found to almost completely suppress the growth of human head and neck cancer cells, liver cancer cells, breast cancer cells, and, at least most of the way, cervical cancer cells within about 3 days. But this was in a petri dish. That's largely the basis of the evidence for the anti-tumor activity of plant lectins, these petri dish studies. How do we even know that dietary lectins are absorbed into the body? Colorectal cancer is one thing. The fact that lectins can kill off colon cancer cells in a petri dish may be applicable, since lectins we eat may come in direct contact with cancerous or precancerous cells in our colon, providing a mechanism by which bean consumption may help in the prevention and treatment of colorectal cancer. Or even more exciting, the potential for effectively rehabilitating cancer cells. The loss of differentiation and invasion are the hallmarks of malignant tissues, meaning that when a normal cell transforms into a cancer cell, it tends to lose its specialized function. Breast cancer cells become less breast-like, colon cancer cells become less colon-like, and what these researchers showed for the first time is that the lectin in fava beans could take colon cancer cells and turn them back into looking more like normal cells. Here's the before picture, cancer cells just growing in amorphous clumps. But then here's those same cancer cells after 2 weeks exposed to the fava bean lectins. The cells have started to go back to growing glandular structures like normal colon tissue. Therefore, dietary lectins, or putting them on a pill or something, may slow the progression of colon cancers, potentially helping to explain why dietary consumption of beans, split peas, chickpeas, and lentils appears to reduce the risk of colorectal cancer based on 14 studies involving nearly 2 million participants. OK, but what about cancers outside the digestive tract? Although lectin-containing foods like beans and whole grains are frequently consumed cooked or otherwise processed, these treatments may not always completely inactivate the lectins. For example, lectins have been detected in roasted peanuts. Peanuts are legumes, and we don't tend to eat them boiled, but just roasted or even raw. Yeah, but are we able to absorb the lectins into our system? Yes. Within an hour of consumption of raw roasted peanuts, you can detect the peanut lectin in the bloodstream of most people. Same thing with tomatoes. Some of the non-toxic lectin in tomatoes also makes it down into our gut and into our blood. The wheat lectin, known as WGA, the wheat germ agglutinin, doesn't seem to make it into our bloodstream, though, even after apparently eating the equivalent of more than 80 slices of bread's worth of wheat germ. And if you ate something like pasta, the boiling might wipe out the lectin in the first place anyway. In terms of phytochemicals in the fight against cancer, lectins are able to resist digestion, resulting in high bioavailability, potentially allowing the cellular mechanisms of the host to utilize the full potential of the quote-unquote dramatic anti-cancer benefits lectins have to offer. But these dramatic benefits have yet to be demonstrated in people. But look, we know that population studies show that the consumption of a plant-based diet is strongly associated with a reduced risk of developing certain types of cancer. Now, they could just be eating fewer carcinogens, but plants do have all those active components that do seem to protect against the initiation, promotion, and progression of cancer. And so maybe lectins are one of those protective compounds. Look, we know people who eat more beans and whole grains tend to get less cancer overall. We're just not sure exactly why. Now, you could say, who knows, who cares? Well, Big Pharma cares. You can't make as much money on healthy foods as you can on lectin-based drugs. Arsenic is a carcinogenic heavy metal, and the major mechanism of arsenic-related damage appears to be oxidative stress. It's the arsenic-induced accumulation of free radicals that can kill off cells and damage our DNA. And then the double whammy is that it may disrupt our body's ability to repair our DNA once it's damaged. Well, if the damage is oxidation, what about eating an antioxidant-rich food, such as the spice turmeric, which contains an antioxidant pigment known as curcumin? As anyone familiar with my videos can attest, numerous clinical trials have suggested therapeutic efficacy against a variety of human diseases, including cancer, diabetes, Alzheimer's, and inflammatory bowel, joint, lung, skin, and eye diseases. In terms of protection against heavy metals, they suggest turmeric may both help scavenge the radicals, as well as chelate, or bind up heavy metals, complete with a fancy, colorful diagram, but it's all just theory until you put it to the test. Unfortunately, until recently, the tests were like this, where you can see if curcumin can protect against heavy metal-induced oxidation in pureed rat brains. Why can't you just give some turmeric to people? It's not like there aren't millions of people out there who've been exposed to arsenic and could use some help. In what became the greatest chemical disaster in human history, so-called tube wells were installed in Bangladesh to provide clean water. UNICEF meant well. Too bad they didn't test the water for arsenic. People started showing up with feet that looked like this, and as many as 1 in 10 in some parts of the country will now go on to die from cancers caused by the arsenic exposure. This allowed the medical community to document all sorts of interesting cancers, but why not give them something that may help, like turmeric curcumin? After determining the extent of DNA damage, 50% of volunteers were randomly selected and prescribed curcumin capsules blended with a little black pepper compound, and the other half were given a placebo. Here's the amount of DNA damage that was found in the curcumin and placebo groups of arsenic-exposed individuals before the study started, compared to the DNA damage found in a control group of individuals not exposed to arsenic, which remained the same throughout the study. Now, they wanted to establish a baseline in the arsenic-exposed group, so they waited for 3 months to start the study, and indeed the DNA damage remained stable. Then for 3 months they proceeded to give them the curcumin or the placebo. The placebo didn't do much, but within the first month you could see the curcumin working, and by the 3rd month the DNA damage in the curcumin-treated arsenic group was no worse than those who hadn't been exposed to arsenic at all. That's amazing. The curcumin had an effective role in the regression of DNA damage. Yes, it's an excellent antioxidant agent, but what they found subsequently is that the curcumin undid the arsenic crippling of our DNA repair enzymes, so both help prevent the damage and facilitate repair. Thus, curcumin may be a useful modality for the prevention of arsenic-induced cancer development. Of course, you have to make sure the turmeric itself isn't contaminated with heavy metals. Oh, those poor kids in Bangladesh. It's not one thing, it's another, and it's not just kids in Bangladesh. Nearly a quarter of spices purchased in Boston had lead in them. And it's not just a matter of buying U.S. versus foreign brands, as the lead levels were not found to be statistically significantly different. How about just eating antioxidant-rich fruits and vegetables? The reason we care about DNA damage is that we care about cancer. What if you measured the beta-carotene levels in people exposed to arsenic who went on to develop cancer compared to those who got exposed to the same amount of arsenic but didn't get cancer? Beta-carotene is like a proxy for healthy fruit and vegetable intake. The way you get high levels in your blood is you eat lots of healthy foods like greens and sweet potatoes. Compared to those with low levels, those with high levels of beta-carotene in their blood had 99% lower odds of getting arsenic-induced cancer, 100 times lower odds. So if you're going to eat rice, why not some rice with some sweet potatoes on top? Autism currently affects about 1 of 68 kids in the United States, yet we don't even have drugs to treat the core symptoms. Forget the underlying disease itself. I mean, we can treat some symptoms, just not the core symptoms of the disorder. Sure, if you're aggressive, we can give you antipsychotic drugs, stimulants like Ritalin for ADHD, or we can knock you out to help you sleep. But for social and communication improvements, the main signs and symptoms of autism, we have little to offer, and the disease appears to be on the rise. What can we do about it? Well, decades ago, a clue was published that offered a ray of hope. When autistic kids get a fever, they invariably display dramatically more normal behavior, including a greater desire or ability to communicate. They could become less withdrawn, more alert, more talkative, more communicative. All hospital staff members working with autistic children noted the marked behavioral improvements. But as soon as the fever stopped, they went back to their baseline. So you think, wow, if we could figure out what's going on, maybe we could develop some sort of treatment. Yeah, but wait a second. Let's take a step back and realize what this could mean. What makes this so groundbreaking, so earth-shattering, is that this challenges the whole presumption that autism is some kind of static, irreversible brain disease where the brain is just inexorably damaged in some way with no hope of recovery. But the fever glimpses suggest no. It may be more of a dynamic brain disease where the normal, healthy circuits are in there somewhere, but being actively suppressed. And the fever somehow lifts that suppression, relieves the active disease process, suggesting if we could figure out what's going on, we could theoretically relieve it not just for days, but for forever. So you'd think that would be what's on every autism researcher's mind, but unbelievably, there's practically no mention of the high fever improved behavior phenomenon in the entire autism medical literature, even though nearly everybody knowledgeable about the disease, both parent and professional alike who deals with it day to day, evidently knows about it. In fact, the first and only Nobel Prize in Medicine ever given to a psychiatrist for brain ailments was the so-called father of fever therapy, where he would inject malaria into people and some got better. If they didn't die first from the malaria, that is. What is it about fever that can improve brain function? If we could figure that out, maybe there's a way we could do it without killing people. OK, but first let's confirm the phenomenon is real. Yes, the rapid behavioral changes reported during fever and autism suggest that those neural networks in autism may still be intact, just dysfunctional, and understanding the reasons for improvement during fever might provide insight into what's going on. But this whole fever effect in autism was based on case reports and anecdotes until this study. Given the potential implications for treatment opportunities, they undertook a formal study of the reported phenomenon, and indeed, autistic children got better when they got a fever, officially documenting the phenomenon as real. OK, so full steam ahead, let's figure it out. Who cares how it works, though? I mean, I know you can't give kids malaria, but why not just take them to a sauna or hot tub or something? Because it doesn't work. When you sit in a sauna or hot tub, your skin gets hotter, but your brain pretty much stays the same temperature. It's got special cooling mechanisms, so no matter what temperature it is outside, your brain stays pretty much the same temperature inside. That's a good thing. That way you can bite into a snow cone without literally getting brain freeze. But when you get a fever, your internal thermostat gets turned up to fight infection, and there is actually an increase in brain tissue temperature. Now, your brain has to be careful not to cook itself to death, so it releases heat shock proteins. As your brain turns up the heat to give you a fever, it releases heat shock proteins to prevent and repair protein damage. At higher temperatures, proteins can start unraveling, what's called protein denaturing. That's what happens when you cook egg whites. The proteins denature. That's not what you want happening in your head. OK, but what does this have to do with autism? Well, one of the causes of autism may be the dysregulation of synaptic function, meaning a dysregulation of the nerve-to-nerve signaling pathways in the brain may play a key role in the cause of autism spectrum disorders. Well, guess what those heat shock proteins do? They protect and sustain synaptic function. OK, so now the question becomes, is there any way to activate the heat shock response without having to get some high fever infection? Well, as you can imagine, there's now strong interest among drug companies to discovering and developing pharmacological agents capable of inducing the heat shock response. But broccoli beat them to it. Sulforaphane, the active ingredient in cruciferous vegetables, cabbage family vegetables like broccoli, kale, and collard greens, activates the heat shock response. No malaria necessary. So in theory, giving those with autism sulforaphane in the form of broccoli or broccoli sprouts might reap the same kind of fever-related benefits in function. At this point, you'd expect me to make some crack about big broccoli and how such a study would never get funded, and you'd be right, until now. See, there are family foundations out there, non-profit foundations, that just want to see people with autism get better, whether or not corporate stock prices get better too. Harvard neurologist Martha Herbert, in a keynote address at an autism conference, said, "We need to conduct research as if we know this is an emergency." Already up to 1.5% of American children have autism, and it appears to be on the rise. Well, what about fever's dramatic effect? This dramatic relief of autistic behavior during a fever continues to tantalize parents and practitioners. From a research standpoint, what could be more revealing than a common event that virtually normalizes autistic behavior for a time? There's so much going on during fever, though. Where do you even begin? Well, once it became understood that one cause of autism may reside in the synapses, the so-called soul of the brain, the nerve-to-nerve junctions where information is transmitted, attention turned to HSPs, heat shock proteins released by the brain when you have a fever that can improve synaptic transmission, and thus may be capable of improving long-range brain connectivity, which is depressed in autism. ASD stands for Autism Spectrum Disorder. And there's this compound sulforaphane that upregulates those heat shock proteins, so you could potentially get the benefits without the fever. What drug company makes it? What do I ask for at the pharmacy? Nope, wrong aisle. Sulforaphane is not made in a chemical plant, it's made by a plant. Sulforaphane is made by broccoli, kale, cabbage, collards, and cauliflower. In other words, cruciferous vegetables. So maybe if we give some broccoli to those with autism, it will make things better by boosting the heat shock proteins. But synaptic dysfunction is not the only contributing cause of autism. There's also oxidative stress. The brain is particularly vulnerable to oxidative stress because lots of free radicals are forged in the brain, which has few antioxidant defense capacities, and indeed, there's a long history of studies showing that autism is associated with oxidative stress and diminished antioxidant capacity. NRF2 levels cut nearly in half, which is what triggers our body's antioxidant response. If only there was a way we could boost NRF2 with foods. Boom! There it is! Sulforaphane just so happens to be perhaps the most potent natural inducer of NRF2 on the planet. What's this NRF2 thing again? It's considered to be a master regulator of our body's response to environmental stressors. Under any kind of stress, oxidative stress, inflammatory stress, NRF2 triggers our antioxidant response elements, activating all sorts of cell-protective genes that balance out and detoxify the free radicals and facilitates protein and DNA repair. So maybe if we give some broccoli to those with autism, it will also make things better by triggering NRF2, which activates those antioxidant response elements. And then there's the mitochondrial dysfunction. Children with autism are more likely to suffer from dysfunctional mitochondria, the little power plants within our cells where metabolism takes place. If only there were some food that could improve mitochondrial function, and there is. A diet rich in cruciferous vegetables effectively retunes our metabolism by restoring metabolic balance. Power plants for our cellular power plants. Not only can sulforaphane boost the gene expression of heat shock proteins as much as 6-fold within 6 hours, it can double the mass of mitochondria in human cells growing in a petri dish. So maybe if we give some broccoli to those with autism, it will also make things better by relieving some of that mitochondrial dysfunction that's creating even more free radicals. OK, so can we try giving some kids some broccoli already? First, one final factor. Neuroinflammation, brain inflammation, another causal factor in autism. If at autopsy you look at brain tissue of those with autism, you can see inflammation throughout the white matter. And if you do a spinal tap, up to 200 times the levels of inflammatory mediators like interferon bathing their brains. What's causing all that inflammation? Well, the master regulator of the inflammatory cascade is a protein called NF-kappa beta, which induces inflammation, and if overexpressed, like in autism, can lead to chronic or excessive inflammation. If only there was a food. Wait, broccoli does that too? In fact, it's the major anti-inflammatory mechanisms for sulforaphane, inhibiting NF-kappa beta. Well, then that completes the picture. Give someone with autism broccoli, heat shock proteins are released to boost synaptic transmission, NRF2 is activated to wipe out the free radicals, mitochondrial function is restored, and we suppress the inflammation triggered by NF-kappa beta. One food to rule them all. One food to counter all 4 purported causal factors. That's one of the differences between foods and drugs. Drugs tend to have single effects. But autism spectrum disorder, ASD, is multifactorial. No wonder there's no drugs that work. but strategies using multifunctional phytochemicals like sulforaphane, or even better, the whole plants themselves, are highly attractive. In theory. But you don't know until you put it to the test. You may remember my series of videos about the engine of aging enzyme TOR. Well, kids with autism tend to have higher TOR activity in their bodies, and this hyperactive TOR signaling may actually play a role in causing autism, making TOR a potential target to treat autism, or even theoretically reverse it if we could target downstream TOR signaling, like between TOR and S6K1. Well, that's actually one of the ways broccoli compounds kills off prostate cancer cells, by inhibiting the signal transduction between TOR and S6K1. Breast cancer, too. Sulforaphane is a potent inhibitor of breast cancer cells because it targets downstream elements of the TOR pathway. So if we gave broccoli to those with autism, if it blocks TOR, maybe it would block some of the synaptic dysfunction that contributes to the features of autism, and that's in addition to blocking autism pathways 4 other ways: oxidative stress and lower antioxidant capacity, the mitochondrial dysfunction, the brain inflammation. And not just in a petri dish, sulforaphane can cross the blood-brain barrier. You eat broccoli, and sulforaphane quickly reaches your brain to exert its protective effects. In theory. But you don't know until you put it to the test. But now you can understand why such a study could attract researchers from leading institutions, Harvard, Hopkins, get published in one of our most prestigious journals, PNAS, the Proceedings of the National Academy of Sciences. But what did they find? Well, first, what did they do? A placebo-controlled, double-blind, randomized trial. Young men, ages 13 through 27, with moderate to severe autism received sulforaphane from broccoli sprouts, or an indistinguishable sugar pill. They were dosed according to body weight. Those under 100 pounds got about a tablespoon of broccoli sprouts worth of sulforaphane a day, which is about a cup's worth of broccoli. Between 100 and 200 pounds, got about 2 cups of broccoli's worth, or 2 tablespoons of fresh broccoli sprouts, and the big boys got 3 cups worth a day, or a little under a quarter cup of broccoli sprouts. Why didn't they just use actual broccoli or actual sprouts? Because then you couldn't have a blinded study. The patients, doctors, and parents would know who's getting the special treatment and who's not, and that could introduce bias just through the placebo effect. So instead, no one knew until the end who got the sulforaphane and who just got nothing in a pill. They chose dietary sulforaphane because of its capacity to reverse oxidation, dysfunction, inflammation. Yeah, but when put to the test, did it actually work? Well, the placebo didn't. Give people with autism nothing, and nothing much happens, but effectively secretly sneak them some broccoli, and substantial improvements in behavior, social interaction, and verbal communication, but it all disappeared once the broccoli stopped. Let me show you what it looks like. This is the ABC score, the Aberrant Behavior Checklist, which includes things like repetitive behaviors. In the placebo group, no big change, which is what you'd expect, but the abnormal behaviors plunged in the sulforaphane group. The group that got the sulforaphane found in about 5 cents worth of broccoli sprouts a day. But the study ended on week 18, and a month later, things were heading back to where they started. Similar findings for a social responsiveness scale, significant improvements until the treatment was stopped, and then caught right back up to how poorly those in the placebo group continued to function. And these weren't just scores on a page. The substantial improvements were conspicuous. The doctors could see it. Their parents and caregivers could see the improvements. No drug has ever been shown to have these kinds of effects. And look, these were young men, starting age 13. One could imagine it working as well or even better for younger children because their brain is still developing. And look, what's the downside? Broccoli sprouts are widely consumed all over the world without any reports of adverse effects. Now remember, we're talking about whole foods, not broccoli or sulforaphane supplements. Remember I did videos about them? Broccoli sprouts work. Commercial broccoli sprout supplements, hardly at all. Broccoli has sulforaphane, florets more than the stems. Broccoli sprouts has like 10 times more, but broccoli pills, powders, and supplements have little or none. So, broccoli and cruciferous vegetables for all kids, autism or not, and hey, maybe pregnant women as well for potential prenatal prevention of autism in the first place. Sodium lauryl sulfate is a common detergent used in toothpaste. It was featured in a famous internet hoax nearly 20 years ago. Colgate toothpaste has it, supposedly proven to cause cancer. At least by buying Colgate rather than Crest, you wouldn't be supporting Satan, or so claimed another famous hoax. The hoax that sodium lauryl sulfate in toothpaste and hair care products was linked to cancer became so widespread the American Cancer Society was forced to publish a response to shampoo the link. Radical emails have been flying through cyberspace, stating sodium lauryl sulfate causes cancer, and it's simply not true. So I just ignored it all these years, until I was doing research on canker sores. You know those painful, shallow, gray ulcerations you get inside your lip or cheek, also known as aphthous ulcers. They can often be set off by trauma, like if you accidentally stab yourself with a toothbrush or something. And so they recommend to try to avoid biting your lip, and also to avoid sodium lauryl sulfate-containing toothpaste, not because of cancer, but apparently for irritation, which at least makes a little more sense. I mean, why would a detergent, a soap chemical, be carcinogenic? Though you could imagine how it might theoretically at least dissolve off some protective layer from the inside of your mouth or something. So I decided to look into it. Although SLS has been used as a foaming agent in toothpaste since the 1930s, our story begins 25 years ago, with an abstract presented at a conference on the possible effects of sodium lauryl sulfate on recurring canker sores. They took 10 men and women, getting more than one sore a week, nearly 18 on average over a 3-month period, using a regular SLS-containing toothpaste, and then they switched them to using an SLS-free toothpaste for another 3 months. And they went from 18 canker sores down to around 5. That's like a 70% decrease. And indeed, what they thought was happening is that the sodium lauryl sulfate was adversely affecting the protective mucus layer that lines our mouth. You always have to be cautious about published abstracts, though. You always want to make sure that they actually go on to publish their findings in a peer-reviewed medical journal. And indeed, in this case, they did. So you can confirm that yes, indeed it was a double-blind study. Yes, indeed they used the exact same toothpaste, just one with the regular concentration of SLS, and the other SLS-free. But still, just 10 patients? It was considered a preliminary study, but with apparently such a dramatic effect, a series of experiments were performed to see what might be going on. As simple as just applying some SLS at the concentration found in toothpaste onto someone's gums with a Q-tip for 90 seconds, and measuring the spike in blood flow to the area, which is a sign of inflammation, presumably because the detergent was penetrating and irritating the gums. Yeah, but does it actually damage the tissue? Researchers smeared some toothpaste on the gums of some dental hygienists 2 minutes twice a day for 4 days. And while the SLS-free toothpaste didn't cause any problems, the ones with the typical amount of sodium lauryl sulfate caused desquamation among most of them. In other words, a sloughing off or peeling of the topmost layers of the inside lining of their mouths. No wonder it might make canker sores worse. It's funny, if you go back to the original American Cancer Society debunking, their response was, sodium lauryl sulfate is not a known carcinogen. It's just a known irritant. Sodium lauryl sulfate had already been used as a foaming agent in toothpastes for more than a half-century by the time this study was published, which showed tissue damage in most of those who had it smeared on their gums, but most of just 10 people. The same with the study that showed a dramatic decrease in the number of canker sores when switching to an SLS-free toothpaste, just 10 people. But that's all we had, until 1999, when a randomized, double-blind crossover trial was published, SLS versus non-SLS toothpaste, in not just 10 people, but 47 people with recurrent canker sores. Looking at the number of days suffering, total pain, number of ulcers, how long they lasted, how big they were, and no significant differences were noted. It didn't seem to matter whether the toothpaste had sodium lauryl sulfate or not. But what about the study showing the 70% decrease? Well, maybe it's because those cases were worse, and so the type of toothpaste only matters if you have really bad canker sores. And that's where the science ended, until 13 years later, when Korean researchers picked up the torch. We had studies showing SLS-free toothpaste helps. We had other studies that found no benefit, leading to considerable controversy. And so they launched the biggest study to date, 90 subjects, and same number of ulcers and ulcer episodes, but the duration they lasted for and average pain score was significantly less when they were using the SLS-free toothpaste. So switching to an SLS-free toothpaste may not reduce the number of canker sores you get, but it may allow them to heal faster and make them less painful. So yeah, sodium lauryl sulfate can create an impression of cleanliness. A mouthful of foam just feels cleaner, but there may be a downside, potentially reducing the protective barrier of our mouth lining, probably due to the rupture of the bonds that hold our cells together, sometimes causing sloughing, ulcerations, and inflammation, drying out the protective mucus layer lining our mouth, making us more vulnerable to irritants. But wait, how did they explain that their study found a problem, but the last study didn't? They suggest it could be a race issue. What? Well, they explain Koreans tend to love their spicy food, and so maybe that makes a difference. Regardless, if you get canker sores, you may want to give an SLS-free toothpaste a try to see if it makes any difference in your case. But non-SLS toothpastes may just have other detergents, most commonly cocamidopropyl betaine. Is that any better? Well, what these Swiss researchers did was just take 9 toothpastes, Colgate, Crest, Oral-B, Sensodyne, etc., and drip them on some human gum cells taken fresh from people who had their wisdom teeth extracted, and then used live dead cell staining. Basically, you stain all cells green, and then you add a red dye that covers up the green, but only in dead cells, because the live cells actively pump out the red dye. So then live cells stay green, but dead cells turn red. Let's see if you can guess if Colgate has SLS in it. All red, all dead. What about Crest? Mostly red, mostly dead. But guess if Sensodyne has SLS in it. All green, all alive. And indeed, it has the SLS-free detergent CAPB instead. What about Oral-B, SLS or no, versus this one, or this one? It seems pretty clear which is which. But that's in a petri dish. Does that translate out into actual tissue damage in people? A double-blind crossover study, SLS-containing toothpaste versus CAPB-containing toothpaste. 42 disquamative reactions, meaning tissue-peeling reactions, after 4 days at 4 minutes a day of the SLS toothpaste on their gums, compared to just 3 with the alternate detergent, and no such reactions at all using the exact same toothpaste, but with just no detergents at all, neither SLS nor CAPB. How does that translate out into canker sore frequency? How about a randomized, double-blind crossover study to investigate the effects of toothpaste containing SLS versus CAPB versus no detergent at all? They found significantly higher frequency of canker sores when patients brushed with an SLS-containing toothpaste than with a non-SLS-containing toothpaste. So they suggest that SLS-free toothpaste be recommended for patients with recurrent canker sores. But they found more than just that. Yes, SLS was the worst, but the non-foaming toothpaste, the detergent-free toothpaste, beat them both out. The non-foaming toothpaste caused significantly fewer ulcers than the non-SLS alternative detergent CAPB, which in turn caused significantly fewer ulcers than the SLS toothpaste. So the vast majority of recurring canker sore patients would benefit from switching from a regular toothpaste to a non-foaming toothpaste, but most would benefit just staying away from the SLS regardless. But if your toothpaste doesn't have sodium lauryl sulfate, will it work as well? I'm not just talking about the impression of cleanliness, but actual plaque and gingivitis. Yeah, SLS may kill our cells, but also kills bacteria cells, so might SLS-free toothpaste not work as well? We didn't know until now. And it turns out the SLS-free toothpaste worked just as well with regard to reducing gingivitis and plaque, and so can be recommended for those with recurrent canker sores. Since sodium lauryl sulfate may make things worse by disintegrating the protective mucus layer and eventually penetrating into the deeper layers of the lining of our mouth where living tissue function may be compromised. However, folks did miss the foaminess, though there is one additional benefit to choosing SLS-free toothpaste. SLS also penetrates into our tongue and interferes with the inner mechanisms of our taste cells. Sodium lauryl sulfate is what's responsible for the orange juice effect. That weird taste you get from citrus right after you brush? SLS is evidently what's mucking with your taste cells. When it comes to the potential human health effects of cell phone use, sure, if you text excessively, you might end up with a crick in your neck, or even a broken neck for you or someone you hit if you do it while driving. On the other hand, think of the countless lives that have been saved on the road because people are now able to so quickly phone in emergencies. But what about cancer? Since the turn of the century, there have been studies suggesting up to a doubling of brain tumor risk with long-term cell phone use on the side of your head where you use it to talk. That's important, since the radiation only really penetrates a few inches into your head. Looking from the back of someone's head or from the top, you can see why you might develop cancer on the one side of your head over the other. Since it's such a local effect, you can see why there are recommendations for using the speaker function or using a hand-free headset, which can reduce brain exposure by a factor of 100 or more, and this includes Bluetooth headsets. This may be particularly important in children who have thinner skulls. Yeah, but cell phone radiation isn't like nuclear radiation. It doesn't damage DNA directly like gamma rays from an atomic bomb or something, but it does appear to be able to damage DNA indirectly by generating free radicals. Out of 100 studies that have looked at that, 93 confirmed these oxidative effects of the kind of low-intensity radiofrequency radiation that comes out of cell phones. OK, but does that oxidative stress translate out into DNA damage? Most studies found it did, finding signs of genotoxicity, damage to our genes, our DNA or chromosomes. Yeah, but a lot of those studies were in a petri dish or lab animals. I'm less interested in whether Mickey or Minnie are at risk. What about brain tumors in people? Yes, some population studies found increased cancer risk. Other studies did not. I wonder if the source of funding of those studies had anything to do with it. Some of the studies were funded by cell phone companies. Researchers suspected that studies would be less likely to show an effect if they were funded by the telecommunications industry, which has the obvious vested interest in portraying the use of cell phones as safe. So they ran the numbers and, surprise, surprise, found that the studies funded exclusively by the industry were indeed substantially less likely to report significant effects. Most of the independently funded studies showed an effect. Most of the industry-funded studies did not. In fact, had about 10 times fewer odds of finding an adverse effect from cell phone use. That's even worse than the drug industry. Studies sponsored by Big Pharma about their own products only had about 4 times the odds of favoring the drug compared to independent researchers, though Big Tobacco still reigns supreme when it comes to big bias. Why do research articles on the health effects of secondhand smoke reach different conclusions? Well, turns out studies funded by the tobacco industry had a whopping 88 times the odds of concluding it was not harmful. So 10 or so times for telecom puts it more towards the drug industry end of the bias spectrum. There's conflicts of interest on both sides of the debate, though, if not financial, then at least intellectual, where it's human nature to be biased towards evidence that supports your personal position. And so you'll see flimsy science like this published, where there appears to be a disturbingly straight line between the states with the most brain tumors and the states with the most cell phone subscriptions. But come on, one can think of lots of reasons why states like New York and Texas might have more brain tumors and cell phones than the Dakotas that have nothing to do with cell phone radiation. Sometimes you might even see outright fraud, with allegations that academic researchers that authored 2 of those genotoxicity papers and this very review were involved in scientific misconduct, which they deny, pointing out that their lead accuser turned out to be a lawyer working for the telecom industry, and on and on. Whenever there's a $1 trillion industry involved, whether it's the food industry, or the tobacco industry, the drug industry, or the telecom industry, there's so much money involved that the science can get manipulated. Take the nuclear energy industry. Decades of high-level institutional cover-ups as to the health consequences of Chernobyl, for example, with the official estimates of resulting health problems 100 or even 1,000 times lower than estimates from independent researchers. Was it just 4,000 who would eventually die from it, or nearly 1 million people? It depends on who you ask, and who happens to be funding whoever you're asking. That's why, when it comes to cancer, all eyes turn to the IARC, the official World Health Organization body that independently and objectively tries to determine what is and is not carcinogenic. Do mobile phones cause cancer? That's a question billions of people would like to know. And that's why we have the World Health Organization's IARC, the recognized authority on what is and is not carcinogenic. There are 5 categories. There are the Group 1 carcinogens, those we know with the highest level of certainty do cause cancer in human beings. Then there are things that probably cause cancer, possibly cause cancer, we're not sure, or probably don't cause cancer. In May 2011, 30 scientists from 14 countries met at the IARC to assess the carcinogenicity of the radiation emitted from cell phones, and concluded that given the limited amount of available evidence, cell phones are a possible human carcinogen. So not a definite human carcinogen, not a Group 1 carcinogen known to be cancer-causing, like plutonium or processed meat, not a probable carcinogen like DDT, or Monsanto's Roundup pesticide, or some regular meat, but a possible carcinogen, down around something like preserved vegetables like kimchi. Now, that was more than 5 years ago. Evidence continues to mount, with the latest 2 2017 systematic reviews showing between a 33% increased odds of brain tumors with long-term use, to 46% higher odds of tumors on the phone side of your head. And that's including the industry-funded studies that have been accused of being biased and flawed, underestimating the risk, as opposed to independent studies free from financial conditioning. How's that for a euphemism? And so some scientists are pushing to have the IARC bump cell phones up to probable carcinogens, or even all the way up into Group 1, at least for brain cancer and acoustic neuromas, which is a type of inner ear tumor. But the IARC classification for cell phones currently remains at possible carcinogen. So what does that mean? What do we do with that information? Well, given the uncertainty, we could follow the precautionary principle and use simple personal measures to reduce our exposure, like not putting the phone directly up to our head all the time. That's the main concern about cell phones, holding it to our head. Whereas there's no evidence of finger cancer risk, so text away. This is considered particularly important for children. Other potential personal recommendations: waiting a moment before putting your cell phone to your ear if you don't have a headset. And don't fall for those anti-radiation gizmos that may make things worse, actually, by forcing the phone to boost the signal. Not all agree with this precautionary approach, however. Employees at two cell phone industry trade organizations emphasize that there are many aspects of human activity that are not totally without adverse health effects, and so we should just accept the risk as being worth it. For example, air travel and hot showers? What, like we might scald ourselves or something? In any case, we shouldn't put out any recommendations that should be left up to the judgment of the parents on a personal basis for their own children. If we put out some kind of guidelines or something, it might make people nervous. And we all know anxiety can have deleterious health consequences itself, so basically the cell phone industry cares so much about your health that it doesn't want you worrying your pretty little head. But that is something openly discussed in the risk analysis literature. Yeah, from a public health perspective, it might be reasonable to provide cell phone users with voluntary precautionary recommendations for their cell phone handling in order to enable them to make informed decisions. But what if the public can't handle the truth? We don't want to freak people out. There's still scientific uncertainty. We don't want to foster inappropriate fears. For example, brain cancer is rare to begin with. You only have like a 1 in 15,000 chance of getting a brain tumor every year. So even if cell phones doubles your risk, that would only take you up to a 1 in 7,500 chance. You may be more likely to get killed by a cell phone in the hands of some distracted driver than by cancer. So whether health authorities want to inform the general public about precautionary possibilities really remains more of a political decision. Physicians and patients have come to expect the annual checkup as a routine part of care. However, considerable research has not demonstrated it has any substantial benefits, and so a revolt is brewing against the tradition of periodic checkups. Even the Society for General Internal Medicine has advised primary care physicians to avoid such routine general health checks for asymptomatic adults. Checkups seem to make sense, but historically medical practice has included all sorts of things that seemed to make sense, such as hormone replacement therapy for menopause, until it was put to the test and found to increase the risk of breast cancer, blood clots, heart disease, and stroke. Or like when doctors killed babies by making the so-called common-sense recommendation that infants sleep on their tummies, whereas we all know now, face up to wake up. We should always demand evidence. We check our cars regularly, though, so why shouldn't we also check our bodies? Well, unlike cars, our bodies have self-healing properties. To see if the benefits outweigh the harms, researchers decided to put it to the test. So what are the benefits and harms of general health checks for adult populations? The bottom line is that checkups were not associated with lower rates of mortality, meaning not associated with living longer or lower risk of dying from heart disease, stroke, or cancer. So general checkups may not reduce disease rates or death rates, but they do increase the number of new diagnoses. And the harmful effects of the tests and subsequent treatments could have balanced out any benefits. Possible harms from checkups include overdiagnosis, overtreatment, distress or injury from invasive follow-up tests, distress due to false positive test results, false reassurance due to false negative test results, possible continuation of adverse health behaviors due to negative test results, adverse psychosocial effects due to labeling, and difficulties with getting insurance now that you have a pre-existing condition, not to mention all the associated costs. For example, diabetes. Wouldn't it be great if we picked up a case of diabetes earlier? Perhaps not, if they were given the #1 diabetes drug at the time, Avandia, which was pulled off the market because instead of helping people, it appeared to be killing people. Adverse drug events are now one of our leading causes of death. When it comes to lifestyle diseases like type 2 diabetes, maybe we should instead focus on creating healthier food environments, like my new favorite organization, Balanced, to help prevent the diabetes epidemic in the first place. How many times have you tried to inform someone about healthy eating, about evidence-based nutrition, only to have them come back and say, "No, I don't have to worry, my doctor says I'm OK. I just had a checkup, everything's normal." As if like having a normal cholesterol is OK in a society where it's normal to drop dead of a heart attack, the #1 killer of men and women. I mean, if you went to see a lifestyle medicine doctor who spent the checkup giving you the tools to prevent 80% of chronic disease, that's one thing. But given the way medicine is currently practiced, it's no wonder, perhaps, why the history of routine checkups has been one of glorious failure. But generations of well-meaning clinicians just don't want to believe it. Policy should be based on evidence, though. Poor diet is on par with cigarette smoking as the most common actual cause of death, yet the medical profession is inadequately trained in nutrition. Worse, nutrition education in medical school appears to be in decline, if you can believe it, a shrinking of nutrition education among health professionals. So the advice you get in your annual checkup may just be from whatever last tabloid your doctor skimmed in the checkout line. Screening opportunities should not be regarded as a form of health education, one medical journal editorial read. People who are obese know very well that they are, and if we have no means of helping them, then we should just shut up. Well, if you really have nothing to say that will help them, maybe you should shut up, especially doctors who say they have no idea what constitutes a healthy diet, though veggies and nuts are a good start. The model of getting an annual physical exam dates back nearly a century in American medicine, but recently many health authorities have all agreed that routine annual checkups for healthy adults should be abandoned. Yet the majority of the public still expects not only a comprehensive annual physical exam, but extensive routine blood testing. Given the gap between patients' enthusiasm and the new guidelines' skepticism about annual physicals, what are physicians to do? Well, first, we must educate patients about preventive practices of proven versus unproven benefit. For example, the only routine blood test currently recommended by the USPSTF, the official preventive medicine guideline-setting body, is cholesterol. The reason why so many physicians continue to perform annual examinations of patients' hearts, lungs, abdomen, even reflexes, and continue to order some of those tests that have been proven ineffectual or even harmful, is because otherwise the patient might leave unsatisfied with the visit. Evidence suggests that the more physical and laboratory examinations they perform, the better patients feel. So they're like placebo maneuvers. But rather than performing unnecessary or worse exams and tests, perhaps physicians should spend some of the time saved by telling their patients why they're not going to just go through the motions like some witch doctor. Most important, we need to educate ourselves about the dangers of overdiagnosis. There will always remain a small possibility that our exam might detect some silent, potentially deadly cancer or aneurysm or something. Unfortunately for our patients, these serendipitous life-saving events are much less common than the false positive findings that lead to invasive and potentially life-threatening tests. This Cleveland Clinic doc shared a story about his own father who went in for a checkup. Can't hurt, right? The doctor thought he felt what might have been an aortic aneurysm, so ordered an abdominal ultrasound. Can't hurt, right? Aorta was fine, but something looked suspicious on his pancreas, so a CT scan was ordered. That can hurt, lots of radiation, but thankfully his pancreas looked fine. But hey, what's that in his liver? Oh, for goodness sake. Looked like cancer, which made a certain amount of sense having worked in the chemical industry, and so realizing how ineffective the treatments were for liver cancer, he realized he was going to die. The daughter was not ready to give up on him, though, convinced him to see a specialist. Maybe if they could cut it out, he could live at least a few more years, but first they had to do a biopsy. And the good news was no cancer. The bad news, though, it was a benign mass of blood vessels, and so when they stuck a needle in it, he almost bled to death. 10 units of blood is like all you have. Pain, and so morphine, and so urinary retention, and so catheter, yet thankfully no infection. Just a bill for $50,000. The frustrating thing is that the whole horrible sequence wasn't like malpractice or everything. Every step logically led to the next. The only way to have prevented this life-threatening outcome would have been to dispense with that initial physical exam, the one that couldn't hurt, right? Well, why, then, do we continue to examine healthy patients? Well, first of all, it's because we get paid to do it. His dad's initial doc only got $100 or so, but just think of all that downstream revenue for the hospital and all the specialists. Overdiagnosis is big business. Yes, too many patients bear the costs and harms of unneeded tests and procedures, but without annual checkups, we doctors would miss out on all those opportunities for open communication and interpersonal continuity, to which one physician replied, "Look, if you've deluded yourself into thinking you're doing more good than harm, if you want communication, why not just take your patients out to lunch or something?" Of course, such lunches should fairly and ethically be preceded by an informed consent discussion that allows prospective diners to understand the risk that they may be patronized to and may well receive unnecessary and injurious interventions as a consequence of that grilled cheese and soup. Particularly, I would add, if you're feeding your patients grilled cheese, having already chalked up your first such unnecessary and injurious act. Atopic dermatitis, more commonly known as eczema, is ranked as the skin disease with perhaps the greatest global health burden, because it's just so common. Maybe 1 in 10 kids have it, and about 3% of adults, where you get patches of red, itchy skin. Topical steroids like cortisone cream is the mainstay of treatment since its Nobel Prize-winning discovery in 1950. People are scared of steroids, though. It's not uncommon for patients to express irrational fear and anxiety about using steroid creams and ointments, a phobia that may arise from confusing topical steroids with oral or injected steroids, which have different effects. Really potent topical steroids can thin your skin, but skin thickness should return to normal a month after stopping. So yes, it can cause side effects, but the concern people have seems out of proportion to the small risk they pose. Still, look, if there's a way you can resolve a problem without drugs, that's generally preferable. What did they do for eczema before the 1950s? Well, in the 30s, some researchers tried using vitamin D dissolved in corn oil, and to their surprise, it worked. But so did the corn oil alone without the vitamin D that they were using as a control. Others reported cases improving after feeding flaxseed oil, or even lard. The National Livestock and Meat Board did not want to be left out of the action. The problem is that none of these studies had a control group. So yeah, feeding someone corn oil for 12 to 18 months, they get better, but maybe they would have gotten better anyway. You don't know until you put it to the test. All these researchers that claimed benefit from the use of various fats apparently lacked any great interest in doing controlled studies, but not this researcher who tried out some oils and found no evidence of benefit over routine treatment. Most got better either way, which suggests that the previous benefits claimed may have been just due to the usual treatments, with perhaps a dash of enthusiasm. By then, hydrocortisone was out, and so the medical community gave up on dietary approaches, until this letter was published in 1981 about the treatment of eczema with supplements of evening primrose oil, which contains gamma-linolenic acid and anti-inflammatory omega-6, and indeed, when it was put to the test, it seemed to help. But then a subsequent larger study found no effect. Whenever there are conflicting findings, it helps to do a meta-analysis, where you put all the studies together. There was the study that showed benefit, the one that didn't, and then 7 other studies. And 7 out of the 7 showed benefit, and so the results showed that the effects of some brand of primrose oil supplement was almost always significantly better than placebo. Case closed, right? Well, the analysis was funded by the supplement company itself, which can be a red flag. Where exactly were these other 7 studies published? They weren't. The company just said they did these studies, but never released them. And when they were asked to hand them over, they said they would, but never did, even threatening a lawsuit against researchers who dared question their supplement's efficacy. An independent review failed to find evidence that evening primrose oil or borage oil worked better than placebo. And so as we bid good night to the evening primrose oil story, perhaps we'll awaken to a world where all clinical trial data reach the light of day. Borage oil actually has twice the gamma-linolenic acid as evening primrose oil, and still didn't work, but that didn't stop researchers from trying hemp seed oil, which has evidently been used as a food and medicine for thousands of years. They tried giving about a quarter cup of hemp seeds worth of oil to people every day for a few months, and found significant improvements in skin dryness, itchiness, and the need for medications, but not compared to placebo. In fact, dietary supplements across the board, whether fish oil, zinc, selenium, vitamin D, E, or B6, sea buckthorn oil, hemp seed, or sunflower oil, overall no convincing evidence that taking supplements improved eczema. Well, that's disappointing, but wait a second. That's just for oral supplements. What about natural remedies applied topically? Despite the availability of drugs with proven efficacy for eczema, like topical steroids, many patients seek out natural alternatives. Which plant, then, should be used for which skin disease? Well, in the case of eczema, two appeared to beat out placebo. One was licorice root. Smearing on a placebo gel didn't appear to help much with clearing redness or itchiness after 1 week or 2 weeks. But a 1% licorice gel, and especially a 2% gel, did seem to clear the symptoms in most patients. They conclude that licorice extracts could be considered an effective eczema treatment agent. The other successful trial was with St. John's wort cream, showing a reduction in eczema severity scores week by week superior to that of placebo, so works better than nothing. But the question is, does it work better than drugs, better than topical steroids? That we don't know. Sometimes the drugs don't work, though, so-called recalcitrant atopic dermatitis. So these researchers in Japan asked patients to try drinking 4 cups of oolong tea every day for a month. And most patients showed marked or at least moderate improvement starting after 1 or 2 weeks. And then most remained better even 5 months after they stopped. The problem is that there was no control group, so we don't know how many would have gotten better on their own. But since drinking tea is healthy anyway, why not give it a try? Back to topical treatments. A vitamin B12 cream beat out the same cream without the B12. Most of the patients and doctors rated the results of the B12 cream as good, better than they rated the placebo cream. Regardless of what topical agent you use, steroid or otherwise, first and foremost, though, it's essential that the skin barrier be protected and maintained with the use of emollients, meaning moisturizers, ideally once or twice a day, especially right after showering to lock in the moisture. Petroleum jelly, like Vaseline, is highly effective, but it's kind of greasy and messy. What about something like coconut oil, which is less greasy? It was found to improve skin dryness, though no better than mineral oil, which is cheaper. Is mineral oil safe, though? Exposure to mineral oil was found to be associated with rheumatoid arthritis, but that was occupational exposure to industrial mineral oils like hydraulic fluid. The same group of researchers subsequently found that cosmetic-grade mineral oil did not seem to carry the same risk. In general, topically applied mineral oil shouldn't present any health risk. That doesn't mean you can safely inject it into your penis, as that may have devastating cosmetic and sexual function consequences. There is, however, one good use for mineral oil on the penis, and that's for penile zipper entrapment. Skin of the penis is susceptible to entrapment in the zipper of careless young boys, particularly those who failed to wear undergarments. Understandably, this mishap provokes distress in the unfortunate victim, in his parents, and ultimately in the healthcare provider charged with the task of liberating the organ. A recommended textbook approach is surgery, believe it or not, but just liberally dose with some mineral oil and you can just slip the zipper off, minimizing trauma for all involved parties. But just because it works as well as coconut oil for dry skin doesn't mean it works as well for eczema. Head-to-head topical virgin coconut oil works better than topical mineral oil at decreasing eczema severity, with twice as many children experiencing an excellent response after 2 months treatment. Thus, among pediatric patients with mild to moderate eczema, topical application of virgin coconut oil was superior to that of mineral oil. But what about compared to virgin olive oil? Olive oil worked, dropping eczema severity, but coconut oil worked better. What do these numbers mean? What does it mean going from a severity score of 35 down to 20 look like? From this to that, before and after 4 weeks of topical coconut oil. Now, we know coconut oil has a lot of saturated fat, so we don't want to eat it, but the saturated fat isn't absorbed into your skin unless you're a baby, where your skin is so thin you can actually absorb saturated coconut fat into your bloodstream. But in older children and adults, using coconut oil on your skin or hair is considered safe. Now, that still doesn't mean you can inject it into your penis. He certainly achieved enlargement, the medical student noted, looking at the swollen red oozing mass before her. OK, but what about treating eczema with just plain Vaseline? Eczema can already be expensive to deal with. The average out-of-pocket cost can be $274 a month. That's more than a third of a typical family's disposable income. And you can rub a kid head to toe with petroleum jelly for like 4 cents, whereas coconut oil or some of the fancier over-the-counter moisturizers can be many times more expensive, though not as bad as some prescription moisturizers that can cost over $100 per tube and work no better than the over-the-counter stuff. Wait, I only see one line. Exactly, they're right on top of one another. No evidence of superiority over the traditional petroleum jelly-based over-the-counter products that can be 65 times cheaper. Yeah, but doesn't virgin coconut oil have active ingredients, whereas petroleum jelly is just inert? Vaseline has been around since 1872, but it took the scientific community 144 years to put it to the test. And it's not inert at all, significantly upregulating genes that fight infection and inducing the expression of genes that help with barrier function, increasing the thickness of the protective outer layer of skin and actively reducing inflammation. Yeah, but is it safe? Not if you inject it into your... What is it with men injecting stuff into their penis? In less severe cases, the problem can be solved with basic surgery. Otherwise, it may require major reconstruction, evidently done a lot by prisoners, giving a whole new meaning to the term jailhouse rock. An unbelievable 1 in 6 inmates at the largest prison in Hungary admitted to Vaseline self-injection. Or how about actual rocks, the surgical implantation of stones in the penis? Or injecting industrial silicone. I'll never look at the term silicone cock the same way ever again. When men were asked why they were injecting fishy substances into their penises, most explained that it was because they felt underendowed, but one guy said he just wanted to give it a try. But why inject cod liver oil into your penis when you can just inject the mercury directly and cut out the middle fish? Anyways, based on 77 studies of moisturizers for eczema, no reliable evidence that one moisturizer is any better than the other, though a consensus of experts concluded that petroleum jelly may be best for skin barrier function protection. Fibroids are the most common benign tumors in women. They get up to a foot in diameter and affect the majority of women before they hit menopause. They tend to be asymptomatic, though, but when symptoms do occur, they tend to manifest as heavy menstrual bleeding, so much so women may get anemic and lots of pain. So what can women do? Up to half go to surgery and get their entire uterus removed. Although it's generally considered a safe operation, obviously you can't have kids anymore, and complications occur in a significant proportion of patients. The alternative is a variety of hormone-modulating drugs, which can shrink the fibroids and provide relief, but many of these drugs have significant side effects, like bone loss, so you really don't want to be taking them for more than a few months. And so bottom line, there's currently no evidence to support the routine use of drug treatment in women for fibroids. No wonder many women turn to complementary and alternative treatments such as exercise, diet, herbs, and acupuncture. Women who exercise 7 or more hours a week do seem to have lower risk of having fibroids than women who exercise less than 20 minutes a day, but it's never been put to the test for treating fibroids. And likewise, there's not a single randomized controlled trial of acupuncture for the treatment of fibroids to date to help guide us. In terms of herbs, there are 2 Asian herbal preparations that show promise, a 5-herb combo called Gizi Fuling, and a Malaysian 10-herb formula which contains secret ingredients, so secret they just list them, but seem to work as well as the leading drug. The problem is that traditional Asian herbal remedies may contain a few extra bonus secret ingredients, like arsenic, mercury, and lead in most of the samples tested off of Asian market and health food store shelves. And not just a little, some apparently had really toxic amounts. So yeah, these 2 Asian herbal preparations may reduce fibroid size, but there remains insufficient evidence as to their safety. And certainly don't try to apply caustic herbs internally, as this can lead to scarring, stenosis, and ulceration. OK, but what about diet? In one of the largest studies of diets and fibroids, fibroid tumors were associated with beef and ham consumption, whereas high intakes of green vegetables seemed to have a protective effect. They figured that the association between estrogen diet and breast and uterine lining cancers might help us understand why. For breast and endometrial cancers, there's a similar direct association with the frequency of meat consumption, with a similar protection conferred by vegetables and fruits. Thus, there may be these shared risk factors between estrogen-responsive malignant tumors like breast cancer and estrogen-responsive benign tumors like fibroids. See, we know the presence of fibroids seems to correlate with an increase in the amount of estrogens, for example, flowing through your body, and women eating vegetarian have significantly lower levels of excess estrogen. Now, they're using this to try to explain why there are lower rates of endometrial cancer, meaning lining of the uterus cancer, and possibly breast cancer among those eating vegetarian, but it could also help explain the fibroid findings. The incidence of breast cancer among vegetarian Adventists is only 60 to 80% that of American women in general, and the incidence among women in Africa or Asia are even lower. Why might women eating vegetarian have lower estrogen levels? This famous study in the New England Journal concluded that it was their increased fecal output that leads to increased excretion of estrogen, resulting in lower blood levels. Double the output, in fact. You can see all the heavyweight Vs compared to the welterweight omnivores. And you can put it to the test. Maybe the same reason African-American women have more fibroids is the same reason they have worse breast cancer survival, too much estrogen in their bloodstream due to a less than optimal diet. So researchers designed this study to see what would happen if they were switched to a more plant-based, higher fiber diet. The women started out with much higher estrogen levels, again helping to explain their increased mortality from breast cancer, but put people on a healthier diet and all their levels come down, suggesting a substantial reduction in breast cancer risk can be achieved by adopting a diet centered around more whole plant foods. And the same appears to be true for fibroids, especially eating lots of cruciferous vegetables, broccoli, cabbage, and Chinese cabbage, as well as tomatoes and apples. Women who underwent premature puberty, starting their periods before age 11, may also be at increased risk of fibroids later in life, and we know higher childhood red meat intake is associated with earlier age of starting one's period, though total and animal protein in general may contribute. For example, girls who eat meat tend to start their periods about 6 months earlier than girls who eat vegetarian. Those that eat meat analogs, meaning like veggie burgers, veggie dogs, started their periods 9 months later on average, and a similar puberty normalizing influence was found with the consumption of whole plant foods such as beans. It could also be the endocrine-disrupting pollutants that build up the food chain. Researchers took samples of internal abdominal fat from women, and there appeared to be a correlation between the presence of fibroids with the levels of a number of PCBs in their fat. So does that mean fish eaters have higher risk of fibroids? Researchers did find a small increase of risk associated with the intake of long-chain omega-3 fats, mostly from dark fish consumption, by which they meant like sardines and salmon. This could be because of the endocrine-disrupting chemicals commonly found in fish, or it could just be a statistical fluke. It would be consistent, though, with the increased risk among sport fish consumers. They're talking about this study. Recognizing that diet and endocrine-disrupting persistent organic pollutants have been associated with a variety of gynecologic conditions, including fibroids, they looked at consumers of fish fished out of the Great Lakes, and found a 20% increased risk for every 10 years they've been eating the fish. This is the most comprehensive study to date. They've compared pollutant levels in fat samples of women with fibroids, compared to fat liposuctioned out of women without fibroids, and didn't just find higher levels of PCBs in fibroid sufferers, but also long-banned pesticides like DDT and hexachlorocyclohexane, PAHs, polycyclic aromatic hydrocarbons formed when coal is burned, tobacco is smoked, and meat is grilled, as well as heavy metals, arsenic, cadmium, lead, and mercury, levels which correlated not only to fibroids, but to seafood consumption or excess body fat. So shedding excess weight and limiting seafood consumption might confer a protective effect on fibroid tumor development, by minimizing exposure to environmental pollutants as much as possible. What about dietary phytochemicals as a possible preventive and therapeutic option of uterine fibroids? Plant-based compounds with disease-preventive properties found in whole grains, fruits, vegetables, beans, split peas, chickpeas, and lentils, herbs, spices, nuts, and certain beverages. The thought is, look, we know they can help regulate the initiation, promotion, and spread of cancerous tumors. So what about benign tumors like fibroids? Most anti-cancer drugs on the market now, for example, were originally derived from plants or plant products. So why not try to use plants to target the inflammation or blood supply of fibroids? Might fibroids be a consequence of chronic inflammation within the body? Well, we know that women with fibroids are more likely to eat more beef and ham and fewer fruit and green vegetables, but whole plant foods don't just have anti-inflammatory effects, but antioxidant effects as well. When the amount of free radicals exceeds the protective effects of antioxidants, oxidative damage will occur, which has been implicated in a variety of disease states, including gynecological conditions such as fibroids. If you collect fresh fibroids, as well as normal uterine tissue from hysterectomy surgeries, the fibroid cells have significantly fewer antioxidant enzymes. So might antioxidant-rich foods help? Well, if you drip some strawberries on in a petri dish, you can apparently kill off some of the fibroid tumor cells while leaving normal uterus cells alone. But what good does that do us? It's only relevant if we can show those strawberry compounds get absorbed through our gut and achieve high enough concentrations in uterine tissue. The same with curcumin, the component of the spice turmeric. One of its so-called miraculous properties is suppressing the growth of uterine fibroid cells. But again, that was just in vitro. Yes, an inhibitory effect was found, and at concentrations that don't compromise the growth of normal, regular uterine tissue, but my patients are people, not petri dishes. I mean, it's neat to see what happens to human fibroid cells as you drip higher and higher concentrations of green tea compounds on them in a test tube. I care less about what happens in vitro or in mice, whether or not they have any clothes on, but there were no randomized controlled clinical studies until now, or at least 2013. Subjects were randomized to green tea extract or placebo for 4 months. In the placebo group, fibroid volume increased 24%. That's what fibroids do. They continue to grow. However, those randomized to the green tea group showed a reduction in total fibroid volume, and not just by a little, a dramatic decrease, shrunk almost a third, a highly significant difference. OK, but did the women feel any better? Yes. a dramatic decrease in symptom severity as well. In the placebo group, nothing much happened month after month, but in those taking the same-looking pill that happened to contain green tea compounds inside, consistent improvement, with women feeling lessening symptoms each month better than the last. And with that, an improved health-related quality of life month after month, significantly better than control. And their blood counts got better too. The blood levels kept decreasing in the placebo group with all that continued excess blood loss every month, but blood counts reversed in the green tea group. So anemia significantly improved because average blood flow significantly diminished. And all this, the fibroid shrinkage, less pain, better periods, with no adverse effects. So not only comparable results than the drugs that are commonly used without the side effects, but comparable results to uterine artery embolization, where they try to cut the blood supply to the fibroid, which is great, unless you accidentally cut the blood supply to the rest of the uterus and cause uterine necrosis, one of many reported major complications, which also includes death not only of the fibroid, but of the patient, and other potential complications that may arise from accidentally clogging off non-target arteries. So a side effect-free solution as good as a more invasive procedure is potentially better than, in my book. They conclude that green tea compounds show promise as a safe and effective therapeutic agent for women with symptomatic fibroids. Such a simple, inexpensive, and relatively safe therapy could improve women's health globally. Now, relatively safe doesn't mean risk-free. Although there were no liver function abnormalities detected, this was a small study. If you give green tea extract pills to 1,000 women for a year, like they did in this breast cancer trial, in about 1 in 17 women, their liver started to get inflamed, a few of which became serious. Now, the dose they used in this study was twice that of the fibroid study, and it's not completely clear if the pills were the only cause, but in general, we should try to avoid extracts and get nutrition in foods as grown, or at least foods as grown dunked in hot water, like green tea. Now, they had to use pills in this study because they wanted it to be a double-blind study, and it's hard to create a fake placebo tea that looks, smells, and tastes like the real thing. So I don't think we should be taking green tea extract pills. We should drink green tea. The problem is that the dose they used was like 11 cups a day worth, which would be a lot of caffeine. But look, you could choose decaf, and it's not outside the realm of possibility to drink a couple quarts of tea a day, especially if it's going to shrink your fibroid so much you can keep your uterus or something. Though, look, for all we know, 5 cups of tea a day would work, or 3 cups, or 1 cup a day. Right? No other dose has been tested. But you can test it in your own life. If you have fibroids, it couldn't hurt to add a few cups of green tea to your daily diet and see if you start feeling better. In my last video about avocados, I described the anti-inflammatory effects and cholesterol and triglyceride-lowering effects. But what about that video I did years ago about the chromosome-damaging effects in a Petri dish? That all goes back to 1975, when a pesticide naturally produced by the avocado tree was discovered, thought to explain why lactating livestock suffered mammary gland damage nibbling on the leaves. The toxin was named persin, also found to be damaging to the heart, which is why you should never feed avocado to your pet birds. But hey, if it attacks mammary cells in animals, might it attack breast cancer cells in humans? It did seem to have the same kind of cell cytoskeleton clumping effect in vitro that chemotherapy can have, demonstrating potent cell growth stopping and killing effects of the novel plant toxin among various lines of human breast cancer cells. So they're thinking about how it might one day be used as chemo itself. But here I am thinking, holy guacamole, Batman, please tell me it doesn't have toxic effects on normal cells too. In 2010, we got an answer. An evaluation of the genotoxicity, the toxicity to our chromosomes of avocado extracts on human white blood cells in a Petri dish. Normally, less than 10% of our dividing cells have any chromosome abnormalities, but drip some avocado fruit extracts on them, and up to half come out defective in some way. They conclude that there's something in avocado fruit that can potentially induce significant genomic instability and some genetic damage in human white blood cells in a petri dish. If the same effect occurs in actual people, it could, for example, result in transforming cells into cancer. That's a big if, though. These were blood cells. You don't inject guac into the vein. For anything to get into our bloodstream, it first has to survive our stomach acid, get absorbed through our intestines, and then sneak past our liver's detoxification enzymes. And indeed, a person may be affected, changed by acidic conditions. And so, given all the differences between what happens in a petri dish and a person, it's essential to carry out further studies before making a final remark about its toxicity. OK, but what do you do before these studies come out? I was concerned enough I provisionally moved it from a stuff-your-face green light food to a moderate-your-intake yellow light food until we knew more to err on the side of caution. Even if a person was utterly destroyed by stomach acid, what about oral cancer? At high enough concentrations, avocado extract can harm the growth of the kinds of cells that line our mouths. Yeah, but this is in a petri dish, where the avocado is coming in direct contact with the cells. But that's kind of what happens in your mouth when you eat it. Right? But it harms oral cancer cells even more. Here's a bunch of oral cancer cells. Those red dots are the mitochondria, the power plants of the cells fueling cancer growth, extinguished by the avocado extract. But since it does this more to cancerous than normal cells, they end up concluding avocados may end up preventing cancer. What about the esophagus, which lies between the mouth and the stomach? They similarly found that an avocado fruit extract appeared to inhibit cancer cell growth more than normal cell growth when it came to colon cancer cells or esophageal cancer cells. But rather than comparing the effects to normal colon and esophagus cells, they compared to a type of blood cell, which again has limited relevance in a petri dish study of something you eat. This study was pretty exciting, though. It looked at P. cresol, which is a uremic toxin, may also be toxic to the liver, has been found associated with autism, and it comes from eating high-protein diets, whereas if you eat more plant-based diet, the only source of prebiotics like fiber and resistant starch, your levels go down. See, fermentation of carbohydrates in the colon, like fiber, is considered beneficial, whereas fermentation of protein, which is called putrefaction, is considered detrimental. So you switch people to a high-protein diet, and within days, the excess protein putrefying in their gut leads to an increase in ammonia as well as P. cresol, in fact, a doubling of levels within a week. But might phytonutrient-rich plant foods like apples, cranberries, grapes, or avocados protect the cells lining our colon from the deleterious effects of P. cresol in terms of cell viability, mitochondrial function, and epithelial integrity, meaning like protection against gut leakiness? Here's that data on barrier function integrity damaged by P. cresol, but rescued by all the cranberry, avocado, grape, and apple extracts, though mitochondrial function was only improved by the cranberries and avocados, and they're also the only ones that appeared to prevent the deleterious effect of P. cresol on colon cell viability. But bottom line, avocados appearing to have beneficial effects on colon lining cells, so that's a good sign. OK, but enough of these in vitro studies already. Yes, an avocado extract can inhibit cancer cell growth in a petri dish, but unless you're doing some unspeakable things to that avocado, like guacamole with benefits, there's no way that the avocado is going to come in direct contact with your prostate cells. So what does this study mean? That's why I was so excited to see this study, the first to actually look for a link between avocado consumption, actual human beings eating avocados, and prostate cancer. So do avocado eaters have more cancer risk or less cancer risk? We'll find out right now. Men who ate the most avocado, more than about a third of an avocado a day, reduced their risk of prostate cancer. In fact, less than half the odds. So with the data on improved artery function, lower cholesterol, and if anything in association with decreased cancer risk, I'd suggest moving it back into the green zone. When you make sauerkraut at home, you don't have to add any kind of starter bacteria to get it to ferment, because the lactic acid-producing bacteria are already present on the cabbage leaves themselves out in the field. This suggests raw fruits and vegetables may not only be a source of prebiotics, fiber, but also a source of novel probiotics. Researchers have since worked on characterizing these bacterial communities and found two interesting things. First, that the communities on each produce type were significantly distinct from one another. So the tree fruits harbor different bacteria than veggies on the ground, and grapes and mushrooms seem to be off in their own little world. So if indeed these bugs turn out to be good for us, that would underscore the importance of eating not just a greater quantity, but greater variety of fruits and veggies every day. And second, they found that there were significant differences in microbial community composition between conventional and organic produce. This highlights the potential for differences in the bacteria between conventionally and organically farmed produce items to impact human health, but we don't know in what direction. They certainly found different bacteria on organic versus conventional, but we don't know enough about fruit and veggie bugs to make a determination as to which bacterial communities are healthier. What about probiotic supplements? I've talked about the potential benefits, but there appears to be publication bias in the scientific literature about probiotics. This is something you see a lot with drug companies, where the sponsor, the supplement company paying for their own probiotic research, may not report negative results, not publish it as if the study never happened. And so then we doctors just see the positive studies. Using fancy statistical techniques, they estimated that as many as 20 unflattering studies were simply MIA. And even in the studies that were published, even when the authors were directly sponsored by some yogurt company, the conflicts of interest were very commonly not reported. There's also been concerns about safety. A review for the government's Agency for Healthcare Research and Quality concluded that there's a lack of assessment and systematic reporting of adverse events in probiotic intervention studies. So while the available evidence in randomized controlled trials does not indicate an increased risk for the general public, the current literature is not well equipped to answer questions on the safety of probiotics with confidence. This is the study that freaked people out a bit. Acute pancreatitis, sudden inflammation of the pancreas, is on the rise, which can become life-threatening in some cases, as bacteria break through our gut barrier and infect our internal organs. Antibiotics don't seem to work, so how about probiotics? Seem to work on rats. If you cause inflammation by cutting them open and mechanically damaging their pancreas, not only do probiotics show strong evidence for efficacy, but there were no indications of harmful effects. So half the people with pancreatitis got probiotics, half got sugar pills, and within 10 days, the mortality rate shot up in the probiotics group compared to placebo. More than twice as many people died on the probiotics. Thus, probiotics for acute pancreatitis, probably not a good idea. But further, probiotics can no longer be considered to be just completely harmless. The researchers were criticized for not telling patients, not cautioning patients about the risk before signing up for the study. The study subjects were told probiotics had a long history of safe use with no known side effects. In response to the criticism, the researchers replied there were no side effects until their study. Medicinal plants are said to be nature's gift to human beings to promote a disease-free, healthy life. Here in reference to amla, a fruit, the Indian gooseberry, described as an Ayurvedic wonder. You hear a lot of that larger-than-life talk about amla coming out of Indian medical journals. who can forget amla, a wonderberry in the treatment and prevention of cancer? Amla is so revered that you find serious scientists at serious academic institutions and serious peer-reviewed medical journals making statements like this. Every part of the Indian gooseberry plant has its unique therapeutic characteristic for the remedy of almost all the ailments, and can be adopted as a, bold italics, single bullet against disease. OK, then. I first ran across it in this famous article, looking at the total antioxidant content of thousands of different foods. I did a series of videos about it ages ago, and to my surprise, the #1 most antioxidant-packed single whole food on the planet, on average, was amla, dried, powdered Indian gooseberries, beating out the prior heavyweight champion cloves with, just for comparison's sake, up to 100 times or more antioxidants by weight than blueberries. So here's this fruit that has enjoyed a hallowed position in Ayurveda, the ancient system of medicine in India, so hallowed it was mythologically pegged as the first tree in the universe. So for thousands of years, before we even knew what an antioxidant was, they were revering this plant that just so happens to turn out to be the most antioxidant-packed fruit on the planet Earth. OK, you got my attention, but I still need to see it put to the test. Well, indigenous tribal healers used amla to treat diabetes, so researchers decided to give it a try. This is the study that originally bowled me over. In fact, the subject of one of my first Nutrition Facts videos of all time, over 5 years ago, the effect of amla fruit on the blood sugars and cholesterol levels of normal subjects and type 2 diabetic patients. In my video, I talked about the jaw-dropping effects of 5 cents worth of this powdered fruit, 5 pennies worth, compared to a diabetes drug. But what about the cholesterol effects? If you take healthy individuals and give them a placebo sugar pill, nothing much happens to their cholesterol. Ideally, we want our total cholesterol under 150. This is a pretty healthy group. The average cholesterol in the U.S. is over 200, which is where the diabetics started out in this study. And when you give them placebo pills, nothing much happens either. But give people just about a half teaspoon of amla powder a day, not some extract or something, just dried Indian gooseberries, a powdered fruit, and this is what happens. That's like a 35–40% drop in 3 weeks. Absolutely astounding. That's the kind of thing we see 6 months after putting people on statin drugs. What we care about most is LDL, the so-called bad cholesterol, shooting for under at least 70, ideally. No impact of the placebos, but again, just about a half teaspoon of amla, which would cost you about 5 cents a day, so like a $1.50 a month, and boom. These results knocked my socks off. I mean, they're just unbelievable. That's why I was so excited after all these years to dig back into the amla literature to see if these findings had been confirmed or replicated elsewhere. So I typed amla into PubMed and waded through all the papers on using amla to decrease methane in cow farts, and speed the growth of chickens. Or hey, what about amla ice cream? After all, amla is packed with fiber and phytonutrients. In contrast, ice cream is not. Therefore, and indeed amla incorporated into ice cream increases the antioxidant capacity, though I would not recommend it for cholesterol lowering. But here we go, a comparative clinical study of amla head-to-head against the cholesterol-lowering statin drug simvastatin, sold as Zocor. Indian gooseberries, otherwise known as amla, have been touted as everything from a cancer fighter to a hair tonic to a refrigerant, whatever that means, like Freon? Not to mention a snake venom detoxifier, complete with fancy diagrams, but based on what kind of research? Yes, dietary intake of both turmeric and amla increases the lifespan of fruit flies, but do we really care about the effects of amla on the lifespan, or the sexual behavior, for that matter, of Fruit flies? How do you even study the sexual behavior of fruit flies? Why, obviously, you just introduce a virgin female and a bachelor male into an Ellens-Watt-Teo mating chamber. Can you imagine having an insect mating chamber named after you? And it looks like there were two fighting over naming rights, so they had to go with both. Then it's just a matter of getting out a stopwatch. 20 minutes is the average duration, but almost a half hour on AMLA, the studly beast, and it dropped the mating latency, the time between when they were introduced to one another in the chamber when they started getting busy, from 10 down to 7. Seconds. They don't mess around. Well, actually, they do mess around, and quite rapidly. And on AMLA, they lay more eggs, and more hatch into larvae. But just like when you hear AMLA is the best medicine to increase lifespan, you're probably not thinking about flies. When you read about AMLA may be a potent aphrodisiac, you're probably not thinking, more maggots. Now, there was this study that found extraordinary improvements in total cholesterol and LDL cholesterol in actual humans. But that was compared to placebo. What about compared to simvastatin, a leading cholesterol-lowering drug sold as Zocor? Treatment with the drug produced significant reductions in cholesterol, as one would expect, but so did the AMLA. In fact, you could hardly tell which was which. Now note this was only about a 10 to 15% drop in total and LDL cholesterol. In this study, the AMLA dose was only 500 milligrams, which is like a tenth of a teaspoon, so smaller than the eighth of a teaspoon a day. And it wasn't just the powdered fruit, but the powdered juice of the fruit, which may have made a difference. How about versus Lipitor, the cholesterol-lowering drug known as atorvastatin? No effect of taking placebos, but significant improvements for the drug, and significant improvements for 2 AMLA doses. But again, only about 15% or so. Did they just use the juice again? No, worse, some patented extract of AMLA. So instead of 5 cents a day, it's 50 cents a day, and doesn't seem to work as well. But because there's this proprietary version, at least there's someone willing to pony up the funds to do the research. It's like the cancer story. For Indian gooseberries to become relevant clinically, they're praying that patentable derivatives be synthesized. Without the possibility of patents, the pharmaceutical industry isn't going to invest in the research. Their shareholders wouldn't let them. It's patents over patients. But without that research, how can we ever prove its worth, or worthlessness, for that matter? So drug and supplement industry interest in patenting natural food product remedies is a double-edged sword. Without it, there would never have been this study showing not only benefits for cholesterol, but also arterial function, reducing artery stiffness in the 2 AMLA extract groups, and the drug group, but not placebo, as well as a dramatic drop in inflammation, C-reactive protein levels cut in half. So AMLA, or at least AMLA extracts, may be a good therapeutic alternative to statins in diabetic patients with artery dysfunction, because it has many of the beneficial effects of the statins, but without the well-known potential adverse side effects of the drugs, including muscle damage or liver dysfunction. The AMLA extract was also compared to the blood-thinning drugs, aspirin and Plavix, often prescribed after heart attacks, and achieved about 3/4 of the same platelet aggregation inhibiting effect as the drugs, significantly increasing the bleeding and clotting time, where they poke you with a needle and see how many seconds it takes you to stop dripping. So that's actually a good thing if you have a stent or something that you don't want to clog up. But it didn't thin the blood outside the normal range, so may not unduly raise the risk of major bleeding. It also appears to decrease the effects of stress on the heart. They had people plunge their hand into ice water and keep it there until the pain became unbearable. This causes your arteries to constrict and your blood pressure to go up, but not as much if you're taking AMLA extract. Good to know for your next ice bucket challenge. Back in the 80s, the Adventist Health Study found strong protective relationships against prostate cancer with increasing consumption of legumes, citrus, dried fruit, nuts, and tomatoes. In the 90s, a Harvard study focused its attention on tomatoes, which appeared to be especially beneficial. They suspected it might be the red pigment in tomatoes called lycopene, which has greater antioxidant power than some of the other pigments, like the orange beta-carotene pigment in carrots and cantaloupes. And lycopene dramatically kills off prostate cancer cells in a petri dish, even way down at the levels one would expect in one's bloodstream after just eating some tomatoes. So of course the Heinz Ketchup Company, along with manufacturers of lycopene supplements, petitioned the FDA to allow them to print health claims on their products. They were essentially denied, saying that the evidence was very limited and preliminary, with no endorsement allowed for ketchup or supplements. By that time, further population studies had cast doubt on the lycopene theory. Consumers of high dietary intakes of lycopene didn't seem to have lower cancer rates after all. But who has high dietary intakes of lycopene? Those that eat the most pizza. So maybe it's no surprise there are mixed results. What we need is to put lycopene to the test. It started with a case study. A 62-year-old man with terminal prostate cancer, failed surgery, failed chemotherapy, metastases all over, spread to the bone, and so he was sent to hospice to die. So he took it upon himself to initiate phytotherapy, plant-based therapy, taking the amount of lycopene found in a quarter cup of tomato sauce, or a tablespoon of tomato paste, every day. His PSA, a measure of tumor bulk, started out as 365, but dropped to 140 the next month, and then down to 8. His metastases started disappearing, and as of his last follow-up, appeared to be living happily ever after. But when given in higher dose pill form, it didn't seem to work. A 2013 review of all such lycopene supplement trials failed to support the initial optimism. In fact, they were just happy that the lycopene pills didn't end up causing more cancer like beta-carotene pills did. But then came 2014. Researchers in Italy had been giving the largest doses they could of lycopene, selenium, and isolated green tea compounds to men with precancerous prostate lesions, hoping they could prevent full-blown cancer. But in 2014, the expanded results of a similar trial were published, in which selenium and vitamin E supplements resulted in more cancer. Yikes! So these researchers stopped their trial and broke the code to unblind the results, and indeed, those taking high doses of lycopene, green tea catechins, and selenium appeared to get more cancer than those who just got sugar pills. The potential implications are dramatic, said the lead researcher, given the current massive worldwide use of such compounds as alleged preventive supplementations in prostate and other cancers. What went wrong? Well, after the beta-carotene pill debacle, researchers measured cellular damage at different natural and unnatural doses of beta-carotene. At dietary doses, beta-carotene suppressed cellular damage, but at higher supplemental doses, it not only appeared to stop working, but caused more damage. And the same with lycopene. Both lycopene and beta-carotene afforded protection against DNA damage at the kinds of levels one might see in people eating lots of tomatoes or sweet potatoes, levels comparable with those seen in the blood of individuals who consume a carotenoid-rich, healthy diet. However, at the kind of blood concentrations that one might get taking pills, the ability to protect the cell against such free radical damage was rapidly lost, and indeed the presence of high levels of beta-carotene and lycopene may actually serve to increase the extent of DNA damage. So no wonder high-dose lycopene pills didn't work. Phytochemicals may be guardians of our health, but the safety of consuming concentrated extracts is unknown. The protective benefits of a phytochemical-rich diet is best obtained through whole plant foods. The food industry has different ideas, though. Soon, there may be phytochemical-fortified bacon, martinis, and ice cream, says this article in the journal Food Technology. If they can find just the right mix of plant compounds, they, quote, hope to reconstruct foods that once contributed to illness and disease to offer significant health benefits. Occasionally, positive things happen in the field of cancer prevention science to popular, good-tasting foods. Yes, broccoli family vegetables are wonderful, but maybe a hard food for the public to swallow. By contrast, who doesn't like tomatoes? But studies using high-dose supplements of lycopene, the antioxidant red pigment in tomatoes, thought to be the active anti-cancer ingredient, failed over and over again to prevent or treat cancer, and may even end up promoting it, since at the high levels one can get with supplements, lycopene may actually act as a pro-oxidant. But lycopene doesn't appear to be effective at lower doses either. There's a strong protective correlation between the intake of actual whole fruit and vegetables and the incidence of certain cancers, but when we supplement with only a single compound isolated in pill form, we may upset the healthy natural balance of antioxidants. It does seem to be quite the human hubris to think we could reproduce the beneficial effects of consuming entire fruits and vegetables by giving supplements of a single phytochemical, which would normally interact with thousands of other compounds in the natural matrix Mother Nature intended. In addition to lycopene, other carotenoids in tomatoes include beta-carotene, gamma-carotene, zeta-carotene, phytofluene, and phytoene, all of which are known to accumulate in human prostate tissue. And there are also numerous non-carotenoid compounds in tomatoes that may have anti-cancer activity, not to mention all the compounds we have yet to even characterize. But it's not about finding the one magic bullet. The anti-cancer effects of carotenoids and other phytonutrients may reside in their combined activity. For example, at low concentrations, the tomato contains phytoene, phytofluene, and lycopene found in most people who eat normal amounts of tomatoes. There's very little effect on cancer cell growth in vitro, used separately, but combine them all together, and a non-effective dose plus a non-effective dose becomes effective somehow, significantly suppressing prostate cancer cell growth. And the same synergy can be seen across foods. Curcumin, the yellow pigment in turmeric, and curry powder, tomato extracts, and the vitamin E found in nuts and seeds do little to inhibit pro-growth signaling of prostate cancer cells, less than 10%, but all three together suppresses growth signaling like 70%. The whole is greater than the sum of its parts. So how about instead of giving cancer patients lycopene pills, we give them some tomato sauce? 32 patients with localized prostate cancer were given 3/4 of a cup of canned tomato sauce every day for 3 weeks before their scheduled radical prostatectomy, and their bloodstream PSA levels dropped by 17.5%. PSA, prostate-specific antigen, is a protein produced by prostate gland cells, and elevated blood levels are routinely used to monitor the success of cancer treatment. It was surprising to find that in just 3 weeks, a tomato sauce-based dietary intervention could decrease PSA concentrations in men with prostate cancer. Also, free radical damage of the DNA in their white blood cells dropped by 21%. Imagine how antioxidant-poor their diet must have been beforehand if less than a cup of tomato sauce a day could reduce DNA damage by more than a fifth. OK, but what did they find in their prostates? Human prostate tissue is thought to be particularly vulnerable to oxidative DNA damage by free radicals, which are thought to play a critical role in all stages of cancer formation. This may be for a number of reasons, including fewer DNA repair enzymes. Well, the researchers had tissue samples taken before the tomato sauce from biopsies, and tissue samples after the 3 weeks of tomato sauce from the surgery. And resected tissues from tomato sauce-supplemented patients had 28% less free radical damage than expected. Here's the DNA damage in the prostate before the tomato sauce, and here's after. Just 20 days of sauce. And what's interesting is that there was no association between the level of lycopene in the prostate and the protective effects. Tomatoes contain a whole bunch of things, some of which may even be more powerful than lycopene. Regardless, in contrast to the lycopene supplements alone, the whole food intervention seemed to help. To see if lycopene played any role at all, one would have to test a lycopene-free tomato. In other words, a yellow tomato. So what if you compared red tomatoes to yellow tomatoes, which have all the non-lycopene tomato compounds, to straight lycopene in a pill? So they fed people red tomato paste, yellow tomato paste, lycopene pills, or placebo pills, and then drip their blood on prostate cancer cells growing in a petri dish. Compared to those not eating anything, the red tomato serum, the blood from those who ate red tomato paste, significantly decreased the prostate cancer cells' expression of a growth-promoting gene called cyclin D1. This downregulation of the gene by the red tomato consumption may contribute to lower prostate cancer risk by limiting cell proliferation. The red tomato seemed to work better than the yellow, so maybe the lycopene helped, but not in pill form. This gene was not regulated by the lycopene pill serum, indicating that maybe it's something else. And lycopene alone significantly upregulated pro-carcinogenic genes. Therefore, it can be stated that tomato consumption may be preferable. So what's the best way? A spouse wrote in to the editor of the Harvard Men's Health Watch, saying his or her husband wants to have pizza for his prostate, to which the doctor replied, "Fine, but how about a cheese-free pizza with broccoli instead of pepperoni? Or he can just drink some tomato juice." What's the latest on treating memory disorders with the spice saffron? Saffron had evidently been widely used in the Persian medical tradition for memory problems, but it wasn't put to the test until this study, which I profiled, showing Alzheimer's dementia symptoms continue to get worse on placebo, but getting better on saffron over a 16-week period. The researchers concluded that, at least in the short term, saffron is safe and effective in mild to moderate Alzheimer's disease. What about head-to-head versus the leading drug used for such patients? It appeared to work just as well, but with significantly less vomiting, a common side effect of the drug. So that's where we were as of 2010. What's the update? In 2013, we got the first glimpse at a potential mechanism. Alzheimer's disease involves brain nerve cell destruction. Our brain cells can be killed by a buildup of tangles or the buildup of amyloid plaques, where aggregates of a protein called amyloid beta act as a poison. But in a petri dish, at least, adding the red pigment found in saffron, called crocin, significantly reduces this amyloid clumping, an effect that can be plainly seen under an electron microscope. So the component of saffron that makes it so colorful appears to have the ability to prevent amyloid formation. What about the tangles? There's the amyloid, and then there's the tangles, which crocin also seems to be able to block in vitro, again, as demonstrated with electron microscopy. So maybe that's why saffron helps in Alzheimer's disease? But do you have to catch it early? Note this was just for mild to moderate Alzheimer's. What about moderate to severe Alzheimer's? We didn't know until now. Head-to-head against the leading drug for severe Alzheimer's, and again, saffron seemed to help just as well. And one might consider just as well better, since there haven't been any serious adverse effects attributed to saffron, whereas the drug is associated with an increased risk of sleepiness, weight gain, confusion, hypertension, nervous system disorders, and falling. And the saffron study wasn't funded by supplement or spice companies, just non-commercial public grants. But all the studies were done in Iran, which controls about 90% of the saffron crop. So there's a national interest in promoting saffron consumption, just like the New Zealand government funds research on kiwi fruit, though who else is going to fund studies on a simple spice? In 1989, the late Charles Janeway gave a presentation that was to revolutionize our understanding of the immune system. He proposed that we must have some ancient innate first line of defense. We knew about vaccination for centuries, how our bodies can learn from past infections, but he figured that's not good enough. Our body must have evolved some way to recognize foreign invaders the first time they invade. He proposed that the way our immune cells discriminate between self and non-self, our own cells versus invading microbes, may arise from pattern recognition receptors. We're just born with the ability to recognize patterns of microbial structure. For example, there's a unique component of fungal cell walls that naturally stimulates our immune system called beta-glucan. Our own cells don't produce it, but fungal pathogens like Candida do. Candida is a type of yeast that can cause serious blood infections, so it's a good idea our immune system recognizes it right off the bat. So yeah, you could stimulate your immune system injecting Candida into your veins, but then you might also die. Luckily for us, non-disease-causing yeasts, like Saccharomyces cerevisiae, which is what baker's yeast is, and brewer's yeast, and nutritional yeast, also have that same molecular signature, that beta-glucan. So the drug industry is all excited about capitalizing on this powerful immunostimulatory response to develop new anti-infection, anti-cancer therapies. But does it have to be injected into the vein? What happens if you just eat some nutritional yeast? Our digestive tract is our largest point of contact with the outside world, more surface area exposed than our lungs and skin put together. And so not surprisingly, most of our immune cells are concentrated along our intestinal wall. But they don't just stay there. Once they're tipped off to what's happening in the gut, they can go off to defend other parts of the body. That's why you can give an oral cholera vaccine, for example, and end up with cholera-fighting immune cells in your salivary glands, pumping out antibodies into your saliva to protect against infection. So what if we sprinkled some nutritional yeast on our kids' popcorn for a snack? Might that help marshal defenses throughout their bodies? Adults tend to just get a few colds a year, but the average school child can come down with a cold every other month. And what can we really do about it? Modern medicine has little to offer for run-of-the-mill common colds. Nevertheless, doctors still commonly prescribe antibiotics, which can do more harm than good. Clearly, there's a need for effective, safe, and inexpensive treatments, and beta-glucan may be just the right solution. But you don't know until you put it to the test. So researchers performed a randomized, double-blind, placebo-controlled trial of about a half a teaspoon of nutritional yeast worth of beta-glucan in children who suffered from repeated respiratory infections, and after a month found a significant increase in salivary lysozyme levels compared to control. Lysozyme is an important protective immune component of our eyes, nose, and mouth, but a larger follow-up study reported the opposite findings, an apparent drop in salivary lysozyme levels. Though the researchers claimed that this was accompanied by pronounced improvements in general physical health, no data is given. But the only reason we care about the lysozyme levels, though, is we were hoping it would result in fewer infections, but that had never been directly studied until now. The title kind of gives it away, but basically a randomized, double-blind, placebo-controlled trial was performed to see if just a dusting of nutritional yeast worth of beta-glucan a day could reduce the number of episodes of common childhood illnesses. During the 12-week course of the study, 85% of children in the placebo group experienced one or more episodes of infectious illness. Here it is graphically. 85% got ill in the sugar pill group, but just taking an eighth of a teaspoon of nutritional yeast worth of beta-glucans, or even just a 16th of a teaspoon's worth, appeared to cut illness rates in half. And those on the yeast that did come down with a cold only suffered for about 3 days, compared to more than 9 days in the placebo group. The researchers conclude that by giving kids these yeast beta-glucans, we could decrease the incidence and severity of infectious illness during the cold and flu season, and thereby benefit the parents as well. I'm often asked in lectures if microwaves are safe, to which I respond, not if you drop them on your foot. But otherwise, it matters what you're putting in them, sweet potatoes and broccoli, or Hot Pockets and Pop-Tarts. Similarly, when I was exploring the safety of hot sauces given their potential for lead contamination, I had the same reaction. It matters what you're putting it on. When I think toxic pollutants, the first thing I think of is the aquatic food chain. We know, for example, that giving people even just a 7-ounce portion of a high-mercury fish like tuna or swordfish once a week, that's about a can and a half of tuna's worth a week, can quadruple mercury levels in the blood within a few months. What about lead? A dietary intervention with not 1 but 5 portions a week significantly increased blood concentrations of toxic metals, including lead. Even though the background intake of lead was found to be disturbingly high, the seafood intake increased it by about a quarter. But from a public health perspective, it's important to recognize that the amount of seafood that they use in that study far exceeds the intake of most populations. Lead can also bioaccumulate in other animals, but half of our dietary exposure to lead probably comes from plant foods. Animals shot with lead ammunition, though, may present a special case. We know lead is toxic and banned from most household items in developed countries, except for lead ammunition, now likely the greatest largely unregulated source of lead that is knowingly discharged into the environment in America. But not just discharged into the environment, but into the meat itself. People generally reject the idea of injecting toxic substances into food, except when it involves hunting wild game. 80% of ground venison was found to contain lead. No surprise, given the hundreds of metal fragments that end up in deer carcasses after being shot with standard lead-based rifle bullets. An impossible number of fragments to pick out by hand, especially because some of these fragments are microscopic. Using X-rays, researchers have shown that during penetration, expanding lead core bullets typically release hundreds or thousands of fragments, or even millions, tens of millions of microscopic lead particles per gram. So one serving could have 1 billion particles, though they were nanoparticles, extremely tiny, about the size of viruses. The only good lead, though, is no lead. Even very low levels of lead exposure can result in brain and nerve damage. Yet most hunters may not be aware about the health risks related to consuming meat from animals killed with lead ammunition. Children may be at risk for losing IQ points, which could reduce their future prospects. A common response from hunters, though, when confronted with the risks of lead exposure may be, "Oh, look, I've been hunting for years and I'm fine." To which this physician responds, "Ah, but just imagine how smart you could have been."